So we started as an air ambulance service, but even before we did our first air ambulance flights, we had already opened 2 clinics in different areas of Nigeria. And now we're sort of an integrated healthcare company with our own clinics, with investments in diagnostic centers, with investments in retail pharmacy, with investments in drug manufacturing, in biotechnology, in telemedicine. So we've gone from doing, just one area of healthcare to operating across the entire healthcare value chain. And of course, our mission has changed as well into a more integrative approach to healthcare in Africa, looking to provide healthcare to some of the, underserved populations across the continent, and making sure ultimately that every African can have access to healthcare that is affordable, that is accessible, and is acceptable, regardless of their socioeconomic status.
What kind of role has your ambulance air service playing, whether it's with COVID-19 or just in general? I know you explained a little bit how you have integrated the approach in your service delivery.
So in terms of our operational company as a Flying Doctors Investment Company, we've been around the country. We set up 8 different testing centers in 8 different states. Some of the busiest testing centers in the country, and we've been actively involved in testing. We've also been involved in setting up the YPO Isolation Center with my business group, Young Presidents Organization here in Lagos, one of the busy centers in Lagos. And then we set up one in another state called River State as well. So we've done 2 isolation centers now. We've been delivering equipment through our logistics investment across the country, including delivering oxygen. We developed a booth for testing, a non-contact booth. So even across our 8 states, with the capability of doing 200 tests per day on each booth, none of the sample takers has contracted COVID-19, because obviously we designed the booths to make sure that there's a barrier in between the tester and the patient. There's an important role for advocacy. There's an important role for continuous education. There's an important role for people continuing to be vigilant, and organizations like ours are also at the forefront of advocacy. But I think that we do need this continuous education and advocacy more than ever, so people have it at the top of their minds that COVID is real.
What do you see are some of the lessons learned from this COVID-19 pandemic?
I think the biggest lesson learned, and I think that this is a global lesson, is that a healthcare problem anywhere is a healthcare problem everywhere. And I think that we'll be seeing a lot more investment on the continent in Africa, because, I think the world has realized that we're only as safe as our weakest link. And a problem in Nigeria, a problem in Congo, a problem in Sudan can become a global problem really, really quickly. So strengthening global healthcare systems is perhaps something that we never thought about, and definitely in America, in Europe, I think it wasn't seen as their problem, a weak healthcare infrastructure in Africa, but I think more and more people are realizing the importance of having very strong global healthcare infrastructure. So I think that that's probably the first lesson learned. I think also the role of prevention, I think is really important. So the role of public health. Our healthcare systems have typically been geared towards treating patients once they're ill, but not necessarily as much money has gone into preventing outbreaks and preventing illness in the first place. And I think that this has shone the spotlight on preventative care. I think also the way that we spend our time has changed. I think we've all been through this traumatic period together as a global community, and I think that we've come out a lot stronger because of it, a lot more contemplative, a lot more introspective, and with a lot more perspective on family, on friends, on relationships.